Hi, my name is James Manson, and I'm doing my interviewing skill, and the chapters I chose was chapter 1, 2, and 5. On one, it reads through the description list of major social work positions, which positions describe most interest you, and explain your interest in a position and impact that will help you have a social work position. And then what I liked about that chapter is the beginning, because the beginning is very important. It's like where do we go from here? That's at the beginning. Getting the client to open up and feel comfortable, be able to talk to me and express themselves, be a little bit more relaxed and relieved. That's why I really chose that. It's like helping. It was the empathy, the attachment, the active involvement, the felt separation. Because after going through all this caring cycle is the beginning, which will prove to me that when you get a little understanding about what the client is want to talk about, and what they really fear, or what they really want to get off their chest or talk about, then it's always the beginning, because you have to be able to have them feel real comfortable to open up, so that they'll be able to talk freely, as much as possible. And that's why I chose that. For example, like the story of just Trayvon. He was a 12-year-old boy. He had ADHD. That's attention deficit hypertension disorder. A lot of kids have that. A lot of them was never diagnosed with it. They have in school. And through all that, he was unable to study. He was unable to focus. He was unable to pay attention. He got in a lot of fights. He did a lot of things, and they really didn't understand it until they got him diagnosed, and it caused him a whole lot of problems all the way up to today. And it came from the social problems, the family that he come from, and the things that he saw, the things that he went through, and that was really traumatizing to him. And as a result of that, it really affected him. So he needed some, social work help, and some guidance, and some therapy, and some, counseling, to bring him, so he'll get to know himself a little bit better, and so he can stop a lot of things that he was doing and understand why he was doing some of the things that he was doing. And in chapter 2, it's to help people that need an address, to help them with resolution and human service, find them places and things if they're in need of any type of work, or if they need any type of health care, social care, counseling, therapy, housing. I chose that chapter also because that's the second part. That's in, after they're opening up and letting them know what's going on with them, and what some of their needs are, or what some of their fears are, or what they can't do, or what they would like to do. I chose that topic because that's that chapter, because that's the second chapter. It tells and explains about, helping them, giving them, helping them with the chores, and helping them with the things that they need, and what social problems, that they can, what we can do together, so that they can really trust me, and open up to me, and know that I am really there to help them, and I'm not just here sitting there talking to them. And in the fifth chapter, that's that's the further response. That's keeping talking to them, trying to get more out of them, and the facial expressions, the way you present yourself to a client, by looking at them, so that you don't intimidate them, and you have a soft voice, so you could, talk to them, so that they'll do the majority of the talking, and you do a lot of listening, and let them freely talk, and find out what's really on their mind, and why they're here, and what can I do to help them. And that's why I chose the fifth chapter, because it tells a whole lot about the wrongs and the rights. And if you don't do it that way, then all of it is like null and void, because the patient or what the client will never open up, won't really tell what's really going on, what they really need. And as a result of that, then you can never help them, because you wouldn't know where to start or where to begin to give them the help or what they really need, or what's the first step of helping them in the process of their needs and counseling and help. So I really like that chapter, you know, and that's what it says. It says, you know, the interviewing skill presenting chapter, which is one more effective, and that's more effective in assisting the opening and if you don't do it right, and said if you don't do it, what would happen if you did it the wrong way? And if you did it the wrong way, then you won't get the information that you really need in order to help the client.